Hi, I'm Dr. Celine Gelgich.
And I'm Dr. Tori Miller.
Welcome to Breaking the Rules.
On Breaking the Rules, we talk about all things OCD.
Obsessive-compulsive disorder, OCD, impacts up to 1 to 2% of the population. We are here to provide not just education, but to inspire clinicians, families and people who are impacted by OCD to be able to access the treatment they need in order to get better.
Catch us every fortnight, wherever you get your podcasts.
Hello.
Hello again.
Hi. What are we talking about today?
Health anxiety and OCD.
Oh, yeah. We get
Yeah.
this a lot, don't we?
All the time.
Yes.
And I'm not going to lie, I had to do a bit of prep for this one.
I know, we both had to refresh our memory.
Yeah. And I think it's because this is a tricky one. And I say that, like I'm happy to say that even though I work in this space, every day.
Yeah.
It's still good to go back to fundamentals because these things trip us up.
Yes, they do.
Yeah.
Oh.
Yeah. So let's
There's
talk
a lot
about
of
it.
similarities.
Yeah.
Yeah, definitely. Yeah. Okay, so let's start with what is health anxiety.
Let's go.
Yeah. So health anxiety, previously known as hypochondria, is really just a fear that is focused on anything health related, from physical illness to food intake to all the things.
Yeah.
And it can create this real sense of uncertainty, anxiety, fear. How does it differentiate from OCD? That is a very good bloody question. If someone could answer that for us, no, I'm joking. How does that differentiate from OCD? Because if we think about OCD, it's characterized by obsessions, so intrusive thoughts that pop in, that are unwanted, that are inconsistent with our values and beliefs, then followed by a behavior that we do, whether it's internal or external, being a mental compulsion or a compulsion we can physically see, to alleviate that distress. Yeah. Now, health anxiety can look almost identical to that.
Yeah, and I think this is where it gets really tricky, right?
It does, because the reassurance-seeking in health anxiety is very common. The physical checking of physical sensations, the body scans, all those sorts of things are very common in health anxiety, but they can also be OCD compulsions.
Yeah.
So which one is it?
I know.
Yeah.
I mean, one of the things that I suppose I wonder about is how much does it matter from your perspective?
Yes, that is a great question.
Yeah. I mean, obviously if we're – okay, let's nut this out, right?
Yeah.
Okay, let's nut this out. I'm going to backtrack. I think I'm jumping in too quickly because I think sometimes what happens in therapy, I know that this is an experience that I have and I've talked about with my supervisees, is you've got a client and we want to do right by our client, of course, and part of that is about discerning what diagnoses they have, what their presenting difficulties are, and formulating those difficulties. And because then we can map an intervention.
Yes.
Right? And the appropriate intervention. We can make really specific choices about what we're going to do. And that is drilled into our training, and it's a really, I think it's a beautiful thing that we psychologists can do.
Yeah.
I think we're really good at it.
I think so.
So then it's really tricky when you have a few things intersecting and it's not exactly clear. Is it health anxiety or OCD, for example? And we want to get it right. We want to have that certainty. We want to know for sure. We want to give the right diagnosis to our clients. We want them to understand themselves the best they can, and we want to provide the right intervention. And health anxiety and OCD overlap so much that I think it can actually be really hard to tease apart. Yeah. And that can generate a lot of anxiety for us as psychologists to want to get the right answer, and it can feel like a bit risky to get it wrong. Yeah.
Because it gets drilled into us too at uni, right?
Yeah.
In terms of the importance of that.
Yeah.
Yeah.
But I guess that is why I come to this question of like, how much does it really matter?
Yeah. I don't think personally for me, and what I tell my supervisees is I don't think it matters too much, only because the treatment is almost identical.
Yeah.
So from a treatment perspective, you're not losing out.
Yeah.
And you're not doing the wrong thing.
Yeah.
From a content perspective, you will find that a lot of it looks and sounds a lot like health anxiety. I think for me, one of the ways and I don't know if this is relevant or not, But one of the ways I've usually differentiated it is between health anxiety being a little bit more convinced and avoidant of wanting to know the answer, as opposed to OCD having more what if thinking and needing to know the answer.
Yes.
Does that make sense?
It does. And I reckon in my experience, people with health anxiety are also a bit more able to receive reassurance.
Yes.
Where they might.
And once or twice is usually enough.
Yeah. And then they can feel reassured, but then the health anxiety pivots to something else.
Yes.
So it goes from this spot to this spot, for example.
Yes.
But it doesn't perseverate on that one thing.
Yeah.
And that's.
Yeah.
Would you agree?
I agree. Yeah.
Yeah.
Yeah. I've seen that too.
Yeah. And so I think that there are some subtle differences, but you're right. Ultimately, the treatment is the same.
Yeah. Yeah.
Yeah.
Very much so.
Yeah.
And even the reassurance, like on the reassurance seeking, typically when it's, you can have health, like OCD as a health subtype.
Yeah.
If that makes sense.
Yeah.
Or you can just have both.
Yeah.
Or health anxiety turns into OCD.
Yeah, that's right.
Where the reassurance becomes more excessive, the checking becomes more excessive, the needing to know, like it just becomes a bit more than what you would typically see.
Yeah.
But you're right. Like from a treatment perspective, for me anyway, and it sounds like for you too, like it doesn't really make too much of a difference in terms of treatment being exposure response prevention.
Yeah.
Yeah.
Why do you think health is such a common theme for people with anxiety and OCD? What is it about, do you think, about us as human beings that trips us up so much that we end up being so focused on health, and it can be so disabling?
I think there's, at the end of if we really delve into it, I think ultimately when we get to a certain point in our lives, whether that's when we're an older child or a teenager or an adult or whatever stage we might be at, where we start to feel vulnerable in life, also knowing that time is not forever.
Yeah.
And
I
think
sense of our mortality.
Yeah. So I have, for me, it comes down to that death anxiety.
Yes.
Around knowing and having a vulnerability to that. And anything can trigger that off at any age, whether it's being young and seeing a pet die, or a grandparent pass away, or a parent. Sadly, for some people, it happens at a very young age. Or when you become a parent and you worry about your legacy and are you going to be available for your children and all that sort of stuff. I've mentioned this before as an intrusive thought, but I remember when my daughter was born being convinced that she had encephalitis because the nurse made a comment about her head circumference being on the larger side. Whereas my husband was like, yeah, she's a genius. And I'm like, oh my God, she's got encephalitis. It's so common. It's so typical. So, yeah, it's just, I think it depends on the stage of life that you're at, and that realization, when you start to realize, shit, we don't actually have control over a lot of things. We have control over some things, like what are we going to eat, etc.
Yeah.
Well, it depends on which our good old, it's bringing back, I'm going on a tangent now, it's bringing back our undergrad psych days of do we have conscious awareness about this? I'm like, let's not delve into that. She's going to get really philosophical. So I think, we like to do these routines and have these things in place to make us feel safe and whatnot.
Yeah.
And health is really important to nearly just about every one of us, because I think that sits deep down in terms of that realization, that vulnerability of shit, this is not forever. And
the fantasy that we can control that we can control our future and we can stave off death.
Yes.
And it gives us a sense of of control over the inevitability. Yeah.
Or grief, that we can keep grief at bay.
Yes.
Like if we keep our if we cook using non-stick cookware or stainless steel cookware and don't use plastics and don't use this and don't use that and all these sorts of things, and I keep my family safe and I won't be responsible for giving them cancer later down the track or some other thing, because then I don't have to go through the grief of losing a loved one.
Yeah, that's right.
Even something like that.
Or the terror of being a bad person or accidentally causing someone's ill health or death.
Yes.
Yeah, that's right.
So I think when it looks like that lends more into OCD with health themes, because there's that typical OCD themes of sense of responsibility, causing harm to others, etc. versus what we were talking
Death
about before,
anxiety.
death anxiety, or like you said, you might have a headache and go, oh, is that a brain tumor?
Yeah.
But then move on quickly to the next thing. Yeah.
Because I think that one of the things that's really hard about our bodies and our health is the amount that we can't see.
Yes.
And the amount that we can't know.
Yeah.
And as well as the degree to which we can't be reassured because we know that cancers grow, for example.
Yep.
And we can't see cancers.
Yep.
They are within us potentially, and sometimes just as precancerous cells.
Yes.
And that there's this notion, I think a lot of people talk about how it's really hard to feel reassured by a scan that says you don't have cancer because well, yeah, but yet.
Yes.
I don't have cancer yet.
Yeah. Or what if you miss something?
What if you
miss
miss
I'm
it?
still coughing.
That's right.
Or whatever.
What if the machine was wrong? What if this? What if that?
Yeah.
But I can really understand that's notion that we can't see within our bodies, like so many aspects of our life where we can dissect it and we can get more certainty and we can know, like you can kind of look under the hood of a car and go, no, it's mechanically sound. Or you can look at your car tire and go, no, there are no punctures, my car's going to drive safely today. But with our bodies,
we
don't know. And weird shit happens.
All the time.
And bad things happen to good people.
Yeah, they do.
And people die young.
Yeah, they do.
Yeah. Yeah. It's a really, really hard aspect of life that generates enormous amounts of anxiety for everybody. I know Irvin Yalom, who's, I love his writings about existential psychotherapy.
So good.
But he talks about this notion that everybody has death anxiety and if someone says that they don't, it's because they're just avoiding it. Yeah. That it's an inevitable part of our humanness to be anxious about losing this beautiful life and to be grief-stricken about the fact that we only get one shot at it.
Yeah. Yeah. And I think that is a huge part of it, the grief around it. Because I think the anxiety, it's easier to feel anxious than it is to feel sad and vulnerable.
Yes.
Because anxiety is motivating.
Yes, it is.
Because it allows us to go, shit, I need to do something.
Yeah, it's a call to arms, isn't it?
I can do something about this. I can avoid this or I can prevent this or I can do whatever.
Yeah.
But truth be told, how many times have we, and this is going to be triggering for a lot of people, even this conversation.
Do it.
But how many times have you heard about the fittest person dying from a heart attack?
That's right.
Or having a cancer diagnosis or something like that.
The person who's never smoked a day in their life gets lung cancer.
My uncle died from lung cancer, never smoked a cigarette in his life.
Really?
It's, so you hear about these things, right? So it's one of these things where, and then you've got someone who chain smokes till they're 100 and they die at 101. What the hell? Please explain.
Yeah, so and there's a sense of injustice there and it's not fair. But you're right that anxiety is much more palatable because it feels like we can do something with that, right? We can, our brain is very good at generating responses to anxiety and things that we can do to make ourselves feel better. Yeah. Yeah, which is much more comfortable than sitting in grief.
Yes.
Yeah.
Absolutely. No one likes sitting in grief.
No.
There's sadness, there's anger, there's all sorts of things. There's bargaining that happens with that, and it just cuts deeper.
Yeah. So health anxiety and health-themed OCD make perfect sense. I think they're really understandable anxieties, and of course, just because people have anxieties about their health doesn't mean that they have health anxiety.
That's
We're talking about, the clinical diagnosis where someone's functioning is really impacted.
Absolutely.
Because they're at the doctor every other day or they're doctor shopping or they're spending
more money than they've got
for tests that they don't need or they can't sleep at night because or they're, not doing a good job at work because they're Googling.
Or Redditing or chat GPTing or you mentioned one earlier. Yeah. I think your teen support group have this really cute rule you were talking about that if you get onto Quora, you've gone too far.
That's what you call it.
That's where you draw the line.
Yeah, you are compulsing now. Get off.
Yeah, that's your red flag.
Yeah. Or or actually even damaging relationships because if this happens a lot, people get sick of being asked for reassurance.
Absolutely.
Or being asked, what do you think this spot might mean? Yes. Or, the impact financially.
Yeah.
This is when
or
health
even doing
really...
things as making sure the family is eating a certain way.
Yeah.
And putting limits and things, which is fine within certain limits and boundaries,
that's right.
It's all about flexibility. I think if there's flexibility around it versus the rigidity and the anxiety and the impact on daily functioning and the impact on other people's lives, that's when it's not okay.
It's the idea of preference versus compulsion.
Yes.
Yeah.
Exactly.
Yeah. If you need to, can you shake it up? If you don't have enough money for certain foods one week, can you pivot?
Can you get KFC on the way home?
Yeah.
Maybe not that extreme. Let's not go that far. I'm joking.
Oh, please, KFC.
I'm joking. I freaking love KFC.
Now I want KFC for lunch.
Maybe we could arrange that. But yeah, like doing those sorts of things or just getting takeout for dinner because you're running low in the fridge or whatever.
Yeah.
As opposed to anxiously freaking out, having a panic attack.
And feeding everyone at 9 o'clock because you've insisted that everyone wait until you can prepare.
And you've made everything from scratch.
Yeah.
Yeah.
So that you feel like you're not hurting your family. Yeah.
And there's a lot of anxiety that goes with that. And it's very real for a lot of people, I think, too.
Yeah.
Not that it's never real, like, anyway. But
yeah. No, it's a really understandable anxiety. And so I think, you're right to say, I think, that sometimes health anxiety becomes OCD, that health anxiety exists first and then the compulsions feel so satisfying that they grow in intensity and then become so embedded that then you're looking more at an OCD framework.
Yeah.
I think sometimes, do you think there's a possibility where someone might have health anxiety and OCD, but none of their OCD have health themes? Have you ever seen that?
I haven't seen it. But I don't think it's impossible. Like, I think it's possible.
Yeah.
Yeah.
I could imagine that OCD would want to latch onto the health anxiety. Yeah. I'd be very surprised if it didn't want to make something out of the health anxiety.
Which is probably why I haven't quite seen it. Yeah. Because it's hard for OCD not to latch onto stuff.
Yeah.
Because if we think about it, latching onto people's values and ideals and beliefs and what they care about the most, that would be a field day for OCD to latch onto.
Yeah. Agreed. I suppose the other thing about imagining the sort of the OCD versus health anxiety is that one of the things that I reckon I've seen is where if someone has health themes in their OCD, it's very rare that they only have that theme.
Yes. Yeah.
That it's only about health.
Yeah.
That often there's might be maybe some contamination in there. Maybe it might also be a bit of harm.
Yes.
Which might present as health anxiety because the obsessions might be around food or about body checking. But underneath that might be some other fears around harm coming to others and things like that. But then also I bet you find some not quite right OCD.
Absolutely. A lot of perfectionism creeping into that too.
And so I think you can see a sort of more complex picture. Yes. Whereas
sometimes even impacting on eating behavior.
Yes, definitely. Well. Definitely. Yeah. Whereas I think when we're talking exclusively about health anxiety, it's much more contained to that.
Yes.
And it seems to be a little bit more
you don't see other themes creeping as much.
Yeah. I mean, there might be generalized anxiety, but I think that's a way to kind of also think about how you differentiate that. Yeah. I think if you did a Y box or another OCD measure with someone, I think you'd see things pop up in other areas as well, even if the health theme is the most prominent.
Yes.
But at the end of the day, you treat them the same.
You do. Yeah. In a sense that, we'd go down the pathway of providing psychoeducation around it, lots of distress tolerance tools, reducing checking behaviors, reassurance-seeking behaviors, any accommodations that might be happening, not just with family, but also with GPs.
Yes, exactly.
And doctors and that sort of stuff, which is really hard for them to do because they can't dismiss.
Yeah.
But then at the same time, with collaboration and that multidisciplinary approach in terms of working together and talking together collaboratively.
Yeah.
I think GPs feel more assured to go, okay, this is what we're dealing with, so I don't have to refer for every MRI
that's
or
right.
whatever.
Yeah. We've done that test. We've done it once.
Yeah.
Yeah.
Yeah, exactly. So I think from that perspective, and then working on gradually leaning into the uncertainty and discomfort and teaching distress tolerance skills and working on ways to come up with exposures to encourage our clients to practice those tools and resist.
Yeah.
But also, and you'll find this with your clients too, coming into what's this really about? What's actually going on here?
Yeah.
Sometimes there's trauma.
Yep.
In terms of losing loved ones or worrying about that or being fearful of that.
I've got a young person who has fairly significant health anxiety and lots of sort of death anxiety.
Yeah.
Stemming from her mum having a breast cancer when she was young, and her mum survived. She's in remission. You know, it was a fantastic outcome, but it's left a scar.
Yeah, of course.
She learned at a very, very young age that awful things happen.
They do, and
to
it's
you
not
and to people
forever.
that you love.
Yeah, exactly.
Yeah.
And so that could be a trigger. So when you peel that away, you're then left with what's driving the behavior. We've talked about form and function before in terms of what does it look like. We can see that, but when we deal with that and we reduce the symptoms, what's left? What's the function of it?
Yeah, that's right.
That's another question to ask as well.
What kind of exposures have you done for health anxiety?
Oh, all sorts of
health OCD.
All sorts of stuff. Watching House
is
a great one. And me chiming and going, what if that was you on the hospital bed?
For people who don't know House, it's a medical show where every week House, who's the doctor, specialist doctor, so it's almost like a sort of an investigative show, who it gets called in to investigate the rarest, strangest kind of medical conditions, and normally, like, you know, death is on the line and they're racing to find an answer.
Yeah.
And so I think it's a really good exposure show because it's, you know, it's not just your run of the mill, oh, there's a virus, you know, it's like, oh, you know,
this is really rare and it's to the line.
Yeah.
As in, like, death is very prominent in a lot of episodes.
Yeah.
Or talk about it anyway.
Yeah, absolutely.
Yeah.
Also shows like, you know, ER.
Yeah.
I think
Grey's Anatomy,
any medical shows.
Yeah.
Even some of the reality shows.
Yes.
About, you know, emergency department wards, things like that.
Yeah. Like is it called ER? The one where they have, like, literally they're in the emergency department and it's a reality show.
I don't know.
Anyway, whatever. Yeah. People might know what we're talking about, or they might not.
Yeah. YouTube's also your friend here.
Yes, definitely. Yep. YouTube's fantastic. Scripting is also wonderful.
Definitely.
We've talked about scripting before in terms of writing down, like eliciting, again, working with your client to elicit intrusive thoughts and that sort of stuff, to trigger urges to want to check their body physically. And then to sit and resist those urges after they've read the script and so on and so forth.
Yeah.
Yeah.
Also,
deleting ChatGPT or your Reddit app.
Yeah.
Is another one.
And resisting the urge to research.
Yes.
Definitely.
Yeah.
Definitely. Obviously reducing reassurance-seeking.
From family, yeah.
Yeah. And also delay. So like delaying going to the doctor.
Yes.
Yeah.
Yes. This is where supervisors go. But what if something actually, yes. What if that one fucking time it's actually a brain tumor or something? Oh God. Make sure you got good insurance. No, I'm kidding.
Yeah, because it's really hard because there are somatic symptoms.
Yes.
It with health anxiety and health OCD. And so how do you know that it's a somatic headache and not a headache because of a brain tumor?
Yes, exactly. So I always say, you know, the good old, that Panadol, was it Panadol? I don't know. Some commercial where it's like, if symptoms persist, please call your doctor. So that's my tagline to my supervisor.
Yes.
If their symptoms persist, then you can go.
That's exactly right.
But if they don't, then.
That's right. That's right.
Yeah.
And it's also about coming back to values, about what is running to the doctor every time you have a symptom doing to your life.
Yes.
What are you missing while you're sitting in a doctor's wait room?
Yeah.
What are you not able to afford because you're spending money on medical bills?
Yes.
And a lot of people would say, well, the reassurance is so gorgeous and lovely that they don't want to leave that out. But
that it allows them to live their life.
That's right.
Yes.
But only for such a short period of time before the next anxiety comes up. And I think if people can, like, helping our clients to connect with the life they could be living if they weren't always in a doctor's surgery or researching, that give them sort of a sense of meaning and purpose.
Yeah.
So that can really help with delay and that sense of, well, it's worth delaying a couple of days to see if the doctors persist, because that means that I can actually see, I don't know, my daughter speak at assembly on Monday, where I would have to miss it because the doctor's only got a time at that same,
Or I'm actually playing with my family
Yeah.
rather than spending 2 hours on Reddit.
Yeah.
Or something like that.
Yeah, that's right.
Or
Yeah.
I'm actually able to go and catch up with my friends for dinner
Yeah.
because I'm not, worried
Yeah.
about whatever else it might be.
Yeah.
Yeah.
Yeah, that's right.
Yeah.
That's right. I know. I think that there's a lot that is missed in life when we're so focused on trying, which is the great irony and the great paradox of
Yes.
OCD, right? Is that, in attempting to live a longer life, we end up living a less meaningful life.
I often say to my clients,
we actually miss our lives.
You do. I often say to my clients, the thing you're fearful of, which is loss of life, has kind of actually already happened.
Yeah.
You might physically be alive, but you're not living. You're just existing.
Yeah, that's
like you're not living your life.
Yeah.
So it becomes a false security blanket. Yeah. The thing you're worried about has actually happened.
Yeah, that's right.
And that realization brings on so much grief for a lot of people. But it's also motivating too.
Yeah, it's a motivator for change, isn't it?
Actually, shit. Yeah, let's do this.
Yeah.
Yeah.
I reckon that's a nice spot to finish.
Yeah, I think so too.
That's a lovely way to wrap up here.
Yeah.
Yeah.
Okay.
Lovely. Great discussion.
Thank you very much.
Thanks, Lean.
Thanks, guys, for watching. We'll see you next episode.